hundreds of different companies have tried to inject clinical decision support into the electronic health record over the past 10 or 20 years, including the electronic health record companies themselves. I think generally we could consider a lot of those as failures, that the fact that you can generate a recommendation does not mean that you can put that recommendation in front of a provider in a way that's meaningful and actionable. There are a number of blockers that cause those failures. For example, maybe you want to recommend a certain order, but you can't actually help the provider place that order in the EHR. Or maybe you want to recommend that order because the EHR didn't indicate the patient had that treatment, like a colonoscopy, because that patient actually received that treatment last week at a different health system. So there are a lot of different challenges regarding clinical decision support and the ability to actually deliver it in the EHR. I think that we are improving, and there are some organizations out there that can create great clinical decision support. But what it comes down to then is user activation. How do you really engage with your users and get them to use your product so that they understand how meaningful that product can be in their workflows, and that they are willing to make changes to how they perform their day jobs to use your product? This is a once-in-a-lifetime opportunity. You're not going to get a lot of opportunities to do this with your providers, so you really have to do the right things when it comes to training and user activation with your first customers and really build upon success. You do not get the chance to actually bring a provider back into your application after they've tried to use it and failed to get value out of it.